As we are celebrating National Diabetes Awareness Month, I would like to throw some light on how medical nutrition therapy entails about leading a healthy dietary habit and can help in rescuing one out of diabetes by actually better helping them in better controlling about their blood glucose level and improving the response to the pharmacotherapies, that is the medicines. Diabetes certainly has become a global concern. As per the latest study done by Indian Council of Medical Research, India is now home to an estimated 101 million diabetics and more than 80 million pre-diabetes. When we talk about diabetes, we are signifying basically more on type 2 diabetes, which is obesity-induced health complications, which cover more than 90 to 95% of prevalent diabetic cases. A diabetic diet plan basically includes 3 meals a day, along with 1 mid-meal snack for maintaining the even calorie distribution throughout the day. This leads to steady release of glucose and prevents the glucose hike or sugar spike in the body. Macronutrient distribution is very important in the diabetic diet. So when we talk about carbohydrates, which are basically the primary source of energy, their intake actually plays a very important role in determining the sugar levels of the body. Carbohydrates contribute to around 45 to 50% of the total energy intake in the diabetic diet. The emphasis when it comes to carbohydrates is on consuming complex carbohydrate that basically gives the bulk to your meal and actually provides very minimum calories. Always remember the general recommendations for having carbohydrate is 130 grams per day. The same can be distributed well among all the major meals and they can actually help in keeping the check to the sugar levels of yours. Not all food produces the same glycemic response. So when choosing carbohydrate, please pay attention to the glycemic index, which indicates how each food will raise your blood glucose or let's say blood sugar levels. The lower the glycemic index, the slower will be the response to the postprandial sugar levels. Glycemic loads, on the other hand, consider the actual quantity of carbohydrate consumed in one meal or one portion. So your nutritionist are the right person to actually help you in planning your meals with the focus on glycemic loads. Now coming to dietary fibers, the general recommendation is 40 grams a day. The simple guideline to follow about dietary fiber is to add on 1 whole serving of whole grain in the major meals. That can either be whole wheat, oats, barley, quinoa, millets, anything. You can also include non-starchy vegetables and green leafy vegetables to add on fiber to your diet. Next comes protein. So it contributes up to 25 to 30% of the total calories. As protein sources are mostly free of carbohydrates, other than plant protein sources, they do not raise blood sugar levels. So one can eat them safely. The minimum protein requirements is 0.8 grams per kg per day. However, for diabetic patients who have chronic renal diseases are put on a low protein diet, which can go low up to 0.5 grams per kg of their ideal body weight per day. As the body has no stores for protein, it's mandated to have optimal portions of good quality proteins daily for the metabolic and functional requirements. So plant sources would include pulses, soy, grams, peas, whereas animal proteins always bring fair amount of fats as well with them, which might aggravate the risk of type 2 diabetes. So it's always advisable to have low fat meats, skinless poultry and fishes which do not exceed 222 grams per day. Dairy products, apart from adding to daily protein needs, they are also essential in meeting the body needs for calcium, potassium and to some extent vitamin D levels. However, each dairy servings add up to 12 grams of carbohydrate, which is actually equal to 1 serving of cereal. So please always count your carbohydrates when adding dairy products in your diet plan. As dairy products are rich sources of saturated fats, the simple rule is to always go to low fat dairy products and to not be careful of not adding any sugar sources to it. When it comes to fat, we should majorly opt for heart healthy fats and oil, meaning the unsaturated fats, which includes monounsaturated fatty acids, MUFA, present in olive oil, canola, olives, avocados, peanuts and peanut oil, and polyunsaturated fatty acids present in vegetable oils including soya beans, safflower, corn oil, sunflower, cottonseed oil. The omega-3 fats, especially EPA and DHA, they possess anti-inflammatory benefits. They keep a check on serum triglycerides, improves the sugar levels, glucose metabolism, and prevents the diabetes related risk. They are the chief They are majorly present in cold water fishes, including salmon, tuna, mackerel, etc. So, non-vegetarians can opt for at least 170 grams of fishes weekly. For vegetarians, the sources for omega-3 fatty acids would be flax seeds, walnuts, soya beans, and their respective oils, as well as canola oil. Saturated fats should not contribute more than 10% of the calories in our daily diet. So, visible fats should ideally be restricted up to 30 ml per day only. So while meal planning, the primary focus should always be on carbohydrate counting and portion control. Carbohydrate counting tool includes food labeling, serving sizes, and food exchange list can actually help in keeping the track of the recommended serving sizes. Also, portion control can be followed introducing the 9-inch plate method approach, where one quarter should be the cereals, ideally including unpolished rice, whole grains, millets or unprocessed cereals. The other quarter should be good quality proteins, and the rest half of the plate should include at least one portion each of the non-starchy vegetables and green leafy vegetables. So if you are diabetic or have pre-diabetes, please consult a clinical nutritionist or your dietitian to develop a healthy diet eating plan for a living diabetic free lifestyle.